is Jennifer Rickerby, and I'm a doctoral nursing practice student at George Mason University. Welcome to our video on incorporating culture into interactions with patients and families. The World Health Organization, the CDC, the American Nurses Association, and the National Center for Cultural Competence all agree that it is vital to incorporate individualized cultural competent care to our patients in order for them to be successful in their care plans. What you're about to see is a compilation of various practitioners in different roles explaining to you what they think cultural competence is and what they have learned by being culturally competent practitioners.
Considering culture when interacting with patients is imperative in ensuring that we're delivering the highest quality of safe, patient-centered care. When you think about a person's health, there are so many factors that are influenced by their personal culture, including the way they approach diet, exercise, their weight, and even the way they may view taking medication and visiting healthcare providers. Because of this reason, it's imperative that healthcare providers are aware of the different needs of each individual patient and their family so that they can come up with a plan that's not only going to be beneficial for their health, but also a plan that the patient is going to be in agreement with and willing to comply with.
Throughout my career as a registered nurse, I have been fortunate to care for individuals from various cultures, ethnicities, religions, and many who speak different dialects. Through patient interactions, communication, and unique experiences, I have learned that understanding an individual's culture improves the care each person receives, enhances the patient-provider relationship, increases the patient's respect and trust in his or her medical team, and overall improves patient outcomes. As a nurse, taking the time to learn a little more about an individual beyond their acute illness or comorbidities demonstrates to the patient that you value what's important to them and care beyond the lab results and vital signs you diligently are monitoring.
You can really see how very important it is to go through the various steps when trying to achieve cultural competence. Initially, you need to see where you are at and do a cultural competency self-assessment. This will help you to identify things that you may need to improve in order to work in culturally congruent areas. After that, it's important to become aware of what people's cultural needs are and to be able to assess them and ask appropriate questions to get that information for them so that you can use it to their best advantage. Also, you must then take those findings and integrate that into the patient's care plan. And the final step, of course, in the nursing process is evaluation. Evaluating what you did, what worked, and what didn't. From there, you can make adjustments and changes to the nursing care plan to ensure that that patient is safe culturally.
Culture is a shared identity that a person develops from what they grow into. And in psychiatry, some things that may appear to be disorders actually in a given cultural context are not considered disorders.
Throughout my career as a registered nurse, I have been fortunate to care for individuals from various cultures, ethnicities, religions, and many who speak different dialects.
Culture and religion has taught me to recognize the dignity of the other and the dignity of their particular beliefs in their various religions.
Through patient interactions, communication, and unique experiences, I have learned that understanding an individual's culture improves the care each person receives, enhances the patient-provider relationship, increases the patient's respect and trust in his or her medical team, and overall improves patient outcomes. As a nurse, taking the time to learn a little more about an individual beyond their acute illness or comorbidities demonstrates to the patient that you value what's important to them and care beyond the lab results and vital signs you diligently are monitoring.
Religion many times is experience that a person has within their culture. Even if that person or family of origin doesn't practice a particular religion, it is still something that shapes them. Something that's important also when asking about religion, especially with a lot of people who don't have an official religion, you can still ask them, what are your spiritual practices, or how do you see yourself spiritually? Because most people at least have some thought as to what they may perceive as spiritually. Now, one of the important things, especially in a psychiatric interview, is to save this question more towards the end when some rapport is developed. That way they're not thinking you're judging them or bringing this up, because these things, just like culture, are very personal and intimate, and also have a lot of meaning behind it, good or bad.
In this last segment, we learned about religion and how religion can be interpreted in various ways according to the individual. It can't be assumed that because two people belong to the same religion that they are both going to do things the same. In fact, it's more important to ask that individual how they interpret their religion and what things that they may perceive as important or not important. Additionally, in this section, we also learned about the importance of medical translation. Having patients work through broken English or giving them written instructions that are not in their native language are going to cause them to have possible medication errors or just in general not be able to achieve the best possible health.
As a bilingual Spanish-speaking nurse, cultural awareness and competence has always been at the forefront of my practice. Unfortunately, I have witnessed the challenges non-English speaking Hispanics have incurred navigating through the complex healthcare system today. As a result of these experiences, I have made a conscious effort to further my knowledge in cultures, religions, and ethnicities that I am unfamiliar with. More often than not, I have observed individuals nod yes to demonstrate understanding of a procedure or medication when they are truly uninformed, or other times, individuals attempt to communicate their concerns, affording necessary prescription medications through broken English. These situations have resonated with me and validate the importance of being an advocate for individuals where English is their second language. I persistently encourage and empower individuals to request interpreters, obtain reading material in their native language, and encourage providers to be mindful of these nuances each unique individual may have to provide patient-centered care. Culture sensitivity and awareness has allowed me to better care for individuals from all nationalities. I think every nurse has a duty to continue enhancing their cultural knowledge to improve patients' experience and their health, which contributes to a healthier community that trusts their medical providers.
In this next section, our providers are going to discuss with you individual situations in which they had to provide care in a different way in congruency with a person's culture. You're going to learn about mother-baby situations, and you're also going to learn about how one operating room nurse took the extra step and actually challenged the other providers that were in the operating room to make sure that her patient remained culturally safe. The outcome was absolutely amazing. Please watch.
I'm currently a mother-baby nurse at a large metropolitan hospital. My coworkers and I often comment on the fact that the area that we live in is a large cultural mixing bowl. We have families from all over the world that come to have their babies at our hospital. So as you can see, it's imperative that we are in tune with the different cultural practices of families and the way that they might view new mothers recovering from just having a baby and how they view caring for a newborn. Some examples of this are breastfeeding, circumcision, blood transfusions, and even some cultures who, from a modesty standpoint, do not wish to have any males in their room unless they've been previously approved by the family.
Cultural competence helps you provide more individualized care. For example, I had a woman that was Jewish. She covered her hair and she was very modest. If I didn't take that into account when I brought her back to the OR, then she would have had her anesthesia and went to sleep terrified. I knew that she was nervous about being exposed in the operating room. So I assured her and her family that I would keep her body and her hair, her head, as covered as I possibly could while she was in the OR. She had to remove her wig, but I found her a blue cap that we usually use in orthopedic procedures that is more like a hood. So it comes down around her face and it covered her neck. I let her wear that into the OR. I had extra blankets. I put a sign on the door saying that we wanted reduced personnel coming in and out of the room. And when I brought her back to the room, she grabbed my hand and she said, "Thank you." And I said, "Don't worry." I said, "I'm going to make sure that you're covered throughout the whole procedure." So the procedure involved her ankle, so her leg had to be partially exposed so that we could prep the area. But I just made a blanket announcement to the rest of the staff and to the surgeon that we needed to keep her as covered as we possibly could because she had very modest values. So after she was asleep, I still kept covering her. I put extra blankets on her. I made sure that her torso wasn't exposed and her arms were covered. And the surgeon and some of the staff had asked me, why would you do that? She's asleep. She's never going to know. And I said, well, my job in considering cultural competence, how she feels, the biggest part of my job is to be an advocate. And if I don't know her values, her beliefs, and how she feels, how can I be an advocate for her? And being an advocate as a nurse doesn't stop when the patient's asleep or they're not in front of you or they can't see what you're doing. Being a nursing advocate is something that you do throughout the whole process while you're caring for that patient, and sometimes even after they leave. So I told the surgeon that my advocacy doesn't stop because she's asleep. I want to be able to look her and her family in the face when she wakes up and tell her that the only thing that she had exposed was from her knee down on the operative leg. But the surgeon did go to the family and he told them what I did, and he told them what he said. And he said that he got taught a lesson that day, that advocacy continues throughout the whole procedure.
By the year 2043, the United States population is going to be shifting. We're now going to be seeing that the numerical majority is actually going to be minority ethnic groups. Therefore, it is very important for us to be able to address cultural competence when we are dealing with these diverse populations. The social determinants of health are things that can keep people from achieving their best possible health. Things such as access to care, to see providers, medications, transportation, food, housing, and other insecurities can majorly affect families and prevent them from receiving the best possible care. This population health nurse is going to discuss ways that the social determinants of health can be addressed. Thank you.
Social determinants of health encompasses social and economic conditions that affect the well-being and health of populations. The Centers for Disease Control and Prevention and Healthy People 2020 define social determinants of health as, in quote, conditions in the places where people live, learn, work, and play affect a wide range of health risks and outcomes. These conditions are known as social determinants of health, end quote. As population health nurses and providers, social determinants of health must be included in the assessment and evaluation of each individual to assist them with lasting lifestyle changes for healthier outcomes. We must meet each individual where they are, identify their priorities and their barriers and their needs to provide the necessary resources, which then positively impacts their individual health.
Not only is it important for existing healthcare providers to increase their cultural competence, it is also important that we are integrating cultural competence into nursing education. Therefore, our students will come out with a good idea of what cultural competency means. This nurse educator is going to discuss the importance that she feels holds in educating our nursing students.
I think that culture is incredibly important for our nursing students to learn. Oftentimes, students haven't really encountered or they're not aware of different cultures, beliefs, and traditions. So, therefore, they don't fully understand how culture can affect a patient's healthcare decisions. Our nursing students will soon be nurses and they will be the patient's advocate at the bedside. So it's important for them to understand why the patient is making the decisions that they're making. Through understanding their culture, they will be able to better advocate for the patient's wishes and desires. And finally, I think that having a full understanding of different cultures can improve the communication between the nurse and their patient.
I want to take this opportunity to thank my providers for participating in this video. I want to thank you for listening to this interdisciplinary approach to culturally competent care. And once again, my name is Jennifer Rickerby, and I'm a doctoral student of nursing practice at George Mason University.